and welcome. We would first like to thank you for agreeing to be part of this unique initiative which seeks to address the concerns in people's mind with regard to the COVID-19 vaccination and living in the new normal. India is just about recovering from the COVID pandemic and is restarting again. This period of the COVID infection has been tough and the challenges haven't quite gone away just as yet. The risk of COVID infections continues as we unlock and start to resume our lives. Today we have with us experts to share with you some advice on how to continue living long and healthy with COVID vaccination. Today we have with us Dr. Amit Kumar Das, consultant physician at Shree Hospital, Muzzafarpur in Bihar. And we also have Dr. Ajit Kulkarni, consultant cardiologist at VGK Heart Institute in Raichur, along with Dr. Ashok Jhingan. He's the chairman at Delhi's Diabetes Research Center. And let's get started. To begin with, Dr. Amit Kumar Das, to you first. Does the immunity that one gets post-COVID-19's infection last longer than the protection one gets from the COVID-19 vaccine?
I don't think this is the complete, fact sheet out. Now, if you compare the natural infection versus immunity created out of vaccination, there are many questions to be answered as yet. But then we definitely know that the COVID infection is somewhere between a disease which gives you a long-term immunity versus a disease which gets you a short-term immunity. So it's somewhere between this. Why I say so? Because there have been some case reports of reinfection with COVID-19. So people who have got a mild disease have got a second bout of infection. So immunity depends upon the severity of the natural infection. So if you get a mild disease, you may get a very short-term immunity. You may even not get any immunity if it's a very, very mild disease. You get proper immunity only when you get severe disease. So the immunity content after a natural infection is variable depending upon the virus infection, the viral load that you get at the outset of infection. But when we compare it with vaccination, here you have a fixed dose of component of virus or the whole inactivated virus pushing in through a controlled way after research has proved that this gives you an adequate amount of antibody. So we have many vaccines available and we have sufficient data to prove that they give you a consistent, continuous and safe immunity against a natural infection where you may get a variable kind of immunity. So to compare a natural infection with a vaccination driven immunity would not be appropriate. I would always favor a vaccination induced immunity rather than myself subjecting to an infection where I may even get a very severe disease, I may die also.
Yes, Dr. Das, thank you for clearing that confusion regarding how long does one get immunity. Like you mentioned, it varies person to person and the kind of infection that they've got and the severity of the infection of COVID-19. But like you mentioned, as far as the immunity that you get after you've got vaccinated, can we say that there is a certain amount of period that you are completely safe and you can go about, go outside and you can feel safe from doing your daily activities? Is there a period of say 3 to 6 months that one can feel safe?
Definitely you are going to get adequate amount of immunity after a certain lay-in period of say 6 weeks after the first dose. So if you're getting a 2-dose vaccine, going to give you an immunity for at least 6 to 8 months. The duration has not yet been studied. We might require a booster dose because of the mutation in the virus. We do not know the answers right now. But I can say for sure that vaccination will give you adequate immunity for at least 6 months to 1 year.
Right. Dr. Ajit Kulkarni, like Dr. Das mentioned, that it can give us immunity from about 6 to about 8 months, but also there is an issue regarding the variants that we have of the COVID-19 now, whether it's the UK variant or it's the South Africa variant, also the Brazil variant. Now, if, for instance, do I still need to quarantine myself after I've been vaccinated if I'm identified as a close contact of someone who might be having the virus?
As already discussed by Dr. Amit, he has clearly stated that vaccination prevents us from getting a severe disease, but still we might end up getting a mild disease, or sometimes we can be a symptomatic carrier of a disease wherein we can transmit the disease to other person. Hence, even if we are vaccinated, even if we are adequately protected, once we are identified as a close contact of a COVID-19 patient, we should take adequate precautions and we should be under quarantine.
Dr. Ashok Jhingan, my question is to you now. Should someone who's pregnant or maybe is breastfeeding or perhaps has a history of gestational diabetes, is it safe for them to get a COVID-19 vaccine?
FDA has approved the vaccine for both, for the pregnant ladies, for the breastfeeding, as well as for those who are going to have a pregnancy. And the good news is that these women who were vaccinated, they were found to have a good amount of the antibodies, and this vaccine was working good. The only thing is that as regards the breastfeeding, that's a very advantage, because in those mothers who were vaccinated, they develop antibodies, and these antibodies are transmitted through the milk in the child, and that's how they get a passive immunity too. Regarding those who are going to get pregnant, so if the person who got a first dose of a vaccination, and during that, between the first and the second dose, if he gets a pregnancy, that means he should go for the second dose at the scheduled time. That means after the 28 days. Because there is no contraindication, of course, about the pregnancy. It has to be, monitoring has to be done, because these all vaccines are now available. So I can tell you the vaccine is safe. They can go ahead with this vaccination program.
Dr. Amit Kumar Das, it was earlier believed that people on ACE inhibitors were at higher risk of COVID-19. Should people on these medications go for vaccination? Is it completely safe? Dr. Das?
Many studies have been done, and it has now come to a rest that ACE2 inhibitors, ACE inhibitors are absolutely safe in people who are into COVID infections. And we have had personal experiences with many number of patients who were already on ACE inhibitors and who contracted COVID infection, and yet the results were unremarkable. So they were unscathed. So as of now, the controversy regarding ACE inhibitors is settled. Individuals who are on ACE inhibitors can pretty well take vaccines as normal individuals, and the issue does not need any any concern right now.
Dr. Ajit Kulkarni, to you now. For someone who might be a heart patient, is there anything one needs to look out for as far as the aftermath of taking a vaccine? After they've gotten their vaccine, is there anything that they need to look out for if one is a heart patient?
See, the issue is patients with any comorbidities like hypertension or diabetes or cardiac illnesses or with lung issues, patients with obesity or high cholesterol, they are at a risk of COVID infection, and they are at an increased risk of severe infection. So definitely these patients should take COVID vaccination whenever their turn comes or as and when required. So once vaccinated, the aftermath, that is after the vaccination process, there might be some small or minor side effects, like the patient might be having pain at the local site, the patient can have a small flu-like illness with a body pain or a fever. So these issues are common to all patients, whether it's a normal patient or it's a cardiac patient. There is no difference. Only thing is, patients who are on blood thinners are very much worried, do we take vaccination or not? Even if the patient is on any of the blood thinners, there is nothing to worry. The patient can safely take a vaccine. Only thing is, once vaccinated, they might have to probably hold on for a minute or more longer at the local site and apply adequate pressure. That's the only thing which needs to be taken care of. And after that, there is no separate issue, or there are no any particular issues as regards to a heart patient. One is patients who are on antiplatelets, and some patients are on stronger blood thinners when they have undergone a valve replacement or other kind of cardiac surgeries. Only in those patients, we need to check something called as a test called as INR. If the INR is very high, only then they need to stop those blood thinning medications like acetron, patients who have been on antiplatelets like aspirin or clopidogrel or ticagrelor, there are no particular issues. There are no separate hazards for these patients. These patients can safely take vaccination, and there are no particular adverse side effects when it comes to cardiac patients. And most of these cardiac patients need not worry regarding COVID vaccination. Even the aftermath of vaccination is not going to be any different as compared to a normal person.
That's great news for people who might be having any sort of heart issue. With that, we're slipping into a very short break. We'll continue our special show on the other side. Welcome back. You're watching our special show, Living Long and Healthy with COVID Vaccination. At this point, I would urge our viewers who are in the eligible category to please go get a COVID shot. Now we have Dr. Ashok Jhingan here who will answer our question regarding the side effects. Are there different side effects in people, especially who are suffering from, say, diabetes?
Most of these patients do ask that I have a diabetes, shall I go for the vaccination or not? So as such, there are not any side effects in these patients. Some patients will have a more side effect after the second dose. But as such, there is not much difference except in diabetic patients, because they have a neuropathy, they have about the joint pain involvement. So in these patients, the severity of these symptoms may be little more. And as such also, the number of the patients who get a side effect is very less. But one thing is sure, as whenever there is after the vaccination for 24 hours, because of immunization, there is an immune reaction is there. Some patients may have about the sugar levels may go up. But otherwise, people should not be afraid of. Just now a patient came and he told me, I'm taking insulin. And people are saying, if you are taking insulin, don't go for a vaccination. These are all false things. Every person can go for a vaccination in the diabetic patients, and there is not anything which is contraindicated. On the contrary, if they get vaccination, they will get a better life and they can protect themselves from the COVID infection.
Right. Dr. Amit Kumar Das, your observations as to how people manage chronic conditions during COVID-19.
People have managed in a variable way. There have been many patients who were very particular about their health, who were very particular about their medicines, they were very particular about their insulin and the injections, and they managed pretty well. But in certain group of patients, it was because of many issues like a non-availability of medicines, non-availability of medical professionals, non-availability of hospital services. In the initial part of the lockdown, many persons, were forced to skip medicines or were skipping their tests and regular appointments with the doctors. Later in the unlockdown phase, people started taking care of, their health again, and they came into the medical treatment part. But still, there were small subset of populations who took this lockdown as a, drug holiday period, and they stopped all medicines. They were all on cooking spree and feeding spree, and they started taking a lot of food. They started gaining weight. Their sugars were bad. Some of the people have had stroke also. To take care of the health, whether there is a lockdown or whether there is a no lockdown, in spite of all, you should take regular appointments on telephone, telemedicine, using the telemedicine, teleconsultation, using applications to purchase medicines, and take regular control of your health.
This question is for those who might have a stent fitted. Should they be going in for the vaccination?
Yeah, I already discussed about this in detail. So patients who have been fitted with a stent, that is patients who have undergone an angioplasty for a heart attack or for a chronic stable angina, are usually on a class of medicines called as antiplatelets. So they thin the blood to some extent, and these medications, what we use frequently in the Indian population, are aspirin or ecospirin, prasugrel or ticagrelor. These are the four medicines or four blood thinning medicines which we give once the stent is fitted. And it is absolutely safe to go ahead with the vaccination on these medicines. And I sincerely request all my viewers not to stop these medications before getting vaccinated. If you stop these medicines, there is a risk of the stent getting blocked. You might have another heart attack and you might get serious. So please don't stop these medicines. Go ahead and get yourself vaccinated safely. Only thing, just press on the local site wherever you're injected for a couple of minutes more. There is nothing else which is required. Please get yourself vaccinated.
Dr. Ashok Jhingan, a major concern about people suffering from diabetes. Does the medication for diabetes have any effect on the vaccination?
Most of the patients do ask that I am on the medication, shall I stop my medication? Till this time, there is no available news or a literature which says that there is an interaction between the vaccine and the insulin or the anti-diabetic drugs. Definitely, one thing should be kept in mind that once you got the injection on your injection site, on that limb, don't inject the insulin. For few days, you can change the site, you use the other limb, or you can change the injection site in the abdomen or in the thighs. So at the same time, at the same place, one should avoid the insulin injection, number one. At the same time, the another thing which should be kept in mind, don't stop your insulin or medicine. I think I fully agree with Dr. Kulkarni that he said the people, many patients have been told, stop your medicines before coming to the vaccination. I think that's a wrong message which has been spread or given to the public. They continue with their medicine, insulin, oral anti-glycemic drugs, and they can go for a vaccination. Only precaution is on that particular site where the vaccination has been given, avoid the insulin injection. At the same time, one should avoid alcohol also for 2 weeks because it is presumed that alcohol suppresses the immunity also. So I advise all my patients that if you are a diabetic, if you are on any of these medicines, oral medications or on insulin, you should not stop your medications because there is no interaction still now reported anywhere in the literature, and it can go along with the vaccination. So they must go for the vaccination. Don't stop your medicines.
Well, thank you so much, Dr. Jhingan. A very good point there that even after you get yourself vaccinated, do keep yourself safe by wearing a mask and maintaining all the protocols. Thank you so much to all the doctors for joining us on our special show. And as we end the show, a quick reminder to all our viewers to get the vaccine as and when they're eligible.